Hi guys, welcome to the new episode of our A to Z series where every day alphabetically we discuss a new most repeated previous year topic of INI-CET, NEET PG and FMGE. And today our episode is episode B where B stands for Barrett's esophagus. So let's begin our discussion with solving some MCQs, and our first MCQ is: which of the following condition is associated with Barrett's esophagus? First option is adenocarcinoma. Second option is squamous cell carcinoma. Third option is adenosquamous carcinoma. And fourth option is eclasia cardia. So what option do you think is the right one? Yes, adenocarcinoma is the right option. Now let's understand Barrett's esophagus in a little detail. Intestinal metaplasia of squamous cell of the esophagus due to reflux of gastric acid. Stratified squamous epithelium of the esophagus is replaced by non-ciliated columnar epithelium with goblet cells. The intestinal-like columnar cells has goblet cells which secrete mucin, which is identified with a stain called Alcian blue. This increases the risk of esophageal adenocarcinoma. Now here are some key features of Barrett's esophagus. The replacement of epithelium characterizes Barrett's esophagus in the lower part of the esophagus due to chronic stress caused by repeated acid reflux. Stratified squamous epithelium of the esophagus is replaced by non-ciliated columnar epithelium with goblet cells. This is called intestinal metaplasia. The risk factors of Barrett's esophagus are Caucasian race, male, age more than 50, central obesity, waist circumference more than 102 centimeters, a history of GERD, smoking, family history of Barrett's esophagus, esophageal adenocarcinoma in first degree relative. So this is a good pictorial description of Barrett's esophagus. So now let's practice a few more MCQs to revise this topic well. Our next MCQ is: which of the following statements about Barrett's esophagus is incorrect? Option A: it is the intestinal metaplasia of esophagus. Option B: mucus secreting foveolar cells are characteristic. Option C: Alcian blue is used in the staining of biopsy specimen. And option D: adenocarcinoma of OG junction is complication. So the right answer is option B. Mucus secreting foveolar cells are characteristic. Barrett's esophagus is characterized by the presence of specialized columnar cells with goblet cells, not mucus secreting foveolar cells. Goblet cells are responsible for producing mucus, and their presence in the columnar epithelium is a hallmark of Barrett's esophagus. Our next MCQ in line is: which of the following is a characteristic feature of Barrett's esophagus? A. Squamous metaplasia. B. Severe dysplasia. C. Intestinal metaplasia. And D. Cuboidal metaplasia. Yes, the right answer is option C. Intestinal metaplasia. Barrett's esophagus is characterized by the presence of intestinal metaplasia. Intestinal metaplasia is the replacement of the normal squamous epithelium of the esophagus with a columnar epithelium similar to that found in the intestine. This change is considered a precursor to the development of esophageal adenocarcinoma. So here is the last MCQ of the day. All is true about the Barrett's esophagus except A. Complication of chronic GERD. B. Seen in 10% of individuals with symptomatic GERD. C. Increases risk of squamous cell carcinoma. And D. Intestinal metaplasia. So yes, the correct option is C. Increases the risk of squamous cell carcinoma. Barrett's esophagus increases the risk of developing adenocarcinoma of the esophagus. So thanks for watching, and that's all for today's episode. See you in our next episode tomorrow. That will be episode C.